Welcome to our video on foundations and life support. We'll be covering essential skills like check call care, CPR, and how to manage common emergencies to help you save precious time when it matters most. In an emergency, every minute counts. Bystanders are almost always first on the scene, and your actions can dictate the outcome. Remember, the brain can only survive 4 to 6 minutes without oxygen, but with the right guidance, even an untrained person can provide effective help. The Red Cross method is simple. Check, call, care. First, check the scene and the person. Second, shout for help and check their status. Third, call 911 or direct someone to do it. Finally, provide care appropriate to your training level until help arrives. When calling for help, the dispatcher needs specific information. Provide your exact location first. Explain what happened and how many people are hurt. Leave your name and callback number and never hang up until they tell you to. For a responsive person, perform an interview using the S.A.M. acronym. Check for signs and symptoms, allergies and medications, or medical conditions. Keep them in a comfortable position and do not move them if you suspect a head, neck, or spinal injury. If you find someone unresponsive and not breathing normally, start CPR immediately. Call 911, get an AED, and place your hands on the center of their chest. Push hard and fast at a rate of 100 to 120 compressions per minute. To perform hands-only CPR, bare the chest, lock your elbows, and position your shoulders over your hands. Maintain a rhythm of 100 to 120 compressions per minute, letting the chest recoil fully, and do not stop until someone takes over for you. When performing CPR on children and infants, rescue breaths are important. Use a 30-to-2 ratio of compressions to breaths. For infants, use the 2-thumb technique. Remember, if you are untrained or unsure, hands-only CPR is always better than doing nothing. An AED is a life-saving tool that will coach you through the process. Simply turn it on and follow the voice prompts. It will tell you when to attach the pads and when to stand clear for analysis. It is designed to be safe and easy to use. For choking, use the 5 and 5 method. Give 5 back blows followed by 5 abdominal thrusts. If the person becomes unresponsive, lower them to the ground gently, call 911, and begin CPR with chest compressions. Some choking cases require adjustments. For pregnant or larger individuals, use chest thrusts. For infants under 1 year, use 5 back blows followed by 5 chest thrusts, never abdominal thrusts. If you are alone, call 911 and use a chair back to perform self-thrusts. If a person is unconscious but breathing normally and you suspect no spinal injury, use the recovery position. Roll them onto their side, tilt the head slightly to keep the airway clear, and continue to monitor their breathing until help arrives. To recognize shock, look for pale, cool skin, rapid breathing, and confusion. Call 911. Treat the underlying cause of the injury. Lay the person flat while keeping them warm with blankets, and do not give them anything to eat or drink. For a severe allergic reaction, watch for hives and swelling. If available, use an epinephrine autoinjector on the outer thigh first, then call 911. Monitor their position based on symptoms and be prepared to use a second dose if needed after 5 to 10 minutes. To summarize, remember check call care for every emergency, push hard and fast for CPR, and use the 5 and 5 method for choking. These basic steps are your best tools in an emergency. Get certified to learn more.